Hello everyone, greetings of the day. I am Sania from Radiance with you on YouTube channel. I am sure all of you must be keeping good health. Today we are diving into a topic that touches everyone under the sun. Literally, we embark on a crucial decision as we raise awareness about fungal infections and the proactive measures we can take to prevent their spread. Fungal infections might or not always be on top of mind when we think about healthcare, but they are certainly not to be underestimated. From athlete food to nail fungus to more serious conditions like invasive candidiasis, these infections can wreak havoc on our health and well-being if left unchecked. But fear not. We are not just here to talk about the problem. We are here to discuss solutions as well. From simple prevention techniques to the latest advancement in treatment, we will be diving deep into strategies for combating fungal infections and safeguarding our health as this is a fungal awareness month. Today, we are thrilled to have Dr. Sanvi Nigade from Kolhapur with us today. Dr. Sanvi is an MBBS MD Dermatology Venereology Leprosy. She leads with a commitment to excellence and patients' well-being. With an impressive academic background, Dr. Sanvi is an MBBS Jawaharlal Nehru Belgaum Medical College, MD DVL Jawaharlal Nehru Belgaum Medical College. Dr. Sanvi Nigade's work experience as consultant dermatologist SHRI multispeciality junior resident JNMC from 2019 to 2022. Welcome. Dr. Sanvi Nigade's professional ethos revolves around providing the same level of care she would want for her own family. She understands the profound impact skin conditions can have on mental health and self-confidence, thus ensuring her patients receive comprehensive and holistic treatment plans tailored to their needs. Thank you so much, Dr. Sanvi, for joining us today. And we are very excited for this very important topic that is fungal infection. We welcome you today.
Thank you.
And doctor, as we will be talking about fungal infection, my very first question is, what are the most common types of fungal infection that people should be aware of? What are fungal infections exactly?
Okay. Am I audible?
Yes, doctor.
So fungal infection, to convey to people, I like to tell in Marathi that fungal infection is called as burshi or it's called as gachkaran in common local language. So these fungal infections, main sign and symptom a patient comes with is itching, profound itching, म्हणजे खाज. They'll have extreme itching and they will develop ring-like lesions that we call as ringworm. तर ह्याला रिंगवर्म म्हटलं जातं. तर हे खास येते आणि मग ते स्किनवर लिजन्स येतात जे काळे चट्टे असतात आणि थोड्या लोकांना काळे चट्टे नंतर पुढे जाऊन इट टर्न्स इनटू रेडिश इफ दे अप्लाय स्टेरॉइड्स. So if a steroid applied fungal infection is there, the patient comes with reddish lesion. And these is present all over the body. सगळ्या अंगभर असू शकते ते फंगल इन्फेक्शन बुरशी. आता कुठं कुठं ओले कपडे घालतात म्हणजे अंगभर जरा ओले कपडे घातले तर अंगभर पसरू शकते. दॅट वी कॉल इट अस टीनिया कॉर्पोरल. आणि जरा मांडीवर असेल बसण्याच्या जागेला असेल त्याला आम्ही लघवीच्या जागेला असेल तर इट इज कॉल्ड एज टीनिया क्रुरस. आणि जे लोक सतत पाण्यात हात घालतात त्यांना फिंगर्स मध्ये फिंगर बेड्स मध्ये असते and even the interdigital spaces. So it's called as tinea anguum manum. In the nails, if it is there, it's called as tinea anguum. In the foot, if it is there, if they are in profound in water place, they are working for a long time in a watery place, then it is called as tinea pedis. आता जे लोक बाहेर काम करतात उन्हाळ्यात काम करतात जे लोकांना खूप घाम येते त्यांना फेसवर पण असू शकते दॅट इज कॉल्ड एज टीनिया फेशियल. नाहीतर बियर्ड एरियाला असू शकते दॅट इज कॉल्ड एज टीनिया बार्बी. So these are different type of fungal infection which most probably patients suffer.
Okay, doctor. And as you have explained that these are the different types of fungal infection, and monsoon is already here. And in India, monsoon की वजह से there are a lot of fungal infections. So what are the fungal infection? Fungal infection. So वो किसी और को भी हो सकता है. So is it like contagious?
Very nicely asked. Yes, this is spread from one family member to other family member. एक माणसाला जरा घरात फंगल इन्फेक्शन झालं तर दुसऱ्या माणसाला पण होऊ शकतो. तर what are the precautions we should take? If one patient is suffering from fungal infection, his or her clothes should be washed separately, bedsheet, linen should be separately washed. आणि त्या माणसाला जे फंगल इन्फेक्शन आहे, he or she should use his separate antifungal soap, not to be shared with others because it is contaminated, दूसरों को भी हो सकता है. And the patient who is getting treated for fungal infection should avoid using tight clothing, using tight jeans, tight clothing, and wet clothes. जो कोई आपले वेट क्लोथ्स आहे, ते ओलसर कपडे असेल तर ते वाळवायचे. कम्प्लिटली ऊन नाहीये तर आता मिनिमम ड्राय करायचं आणि त्याला इस्त्री करूनच घालायला पाहिजे. So it is very communicable disease. It can spread to other people. So precautionary, one should individually take care that he shouldn't spread it to the other family.
ओके, सो यानी कि प्रिकॉशंस आर वेरी इंपॉर्टेंट इफ किसी को भी फैमिली में फंगल इन्फेक्शन है, सो वन शुड टेक प्रॉपर प्रिकॉशंस, जैसा कि आपने बताया. इफ समवन इज वेयरिंग क्लोथ्स, सो उसकी क्लोथ्स एंड सब वो अलग से ही वॉश होने चाहिए. सो दीज आर द वी कैन से फंगल इन्फेक्शन कैन टिपिकली स्प्रेड. डॉक्टर, व्हाट आर द रिस्क फैक्टर एसोसिएटेड विद these fungal infections?
So mainly, all people can get fungal infections. It is, as I said, by wearing clothes, wet clothes, one can get fungal infection. But more prone are those people who have sugar, diabetes. Diabetic logo may they get recurrent fungal infections because their immunity level is coming down, their HbA1c is increasing. HbA1c increase होने से क्या होता है? WBCs are decreasing and immunity level is going down. So जो डायबिटिक पेशेंट है उनको रिकरेंट फंगल इन्फेक्शन हो सकता है. So one diabetic patient can get his or her sugar levels in control and at the same time take treatment for fungal infection. So ये कवर हो सकता है. Next are onco means cancer patients. उनके immunity कम रहती है और these are immunocompromised. So they also can get recurrent fungal infection. Thirdly are the patients who are on steroids. जो पेशेंट स्टेरॉइड पे है उनका इम्यूनिटी भी कम होता है, उसके वजह से फंगल इन्फेक्शन हो सकता है. ऑन द कॉन्ट्ररी नॉर्मल पीपल जो एक दवाई नहीं ले रहे उनको भी रिकरेंट फंगल इन्फेक्शन इस मानसून में हो सकता है, क्योंकि वेट क्लोथ्स, इफ दे आर यूजिंग रिकरेंटली वेट क्लोथ्स, टाइट जीन्स पहन रहे तो रिकरेंटली उनको फंगल इन्फेक्शन हो सकता है. And the preventive measure for this is get consulted with a dermatologist if you are getting recurrent fungal infections.
Okay, so as you have mentioned that these are the people जिन्हें diabetes है और sugar है, so they are more prone to fungal infections. Doctor, here comes the question: are there any specific populations they are susceptible to fungal infection, like children or young age or youth? Is it like that?
Yeah, depending upon the occupation, children who have more use of hand washing or they are more into water, they can get hand fungal infection, water sweatis, tinea manner. And those occupations who are working in the farms or who are constantly working in a humid environment, they are prone for continuous sweating. So उनमें भी fungal infections common है sweating के वजह से. And mostly housewives who are working continuously in kitchen in a humid environment, उनको sweating ज्यादा होता है, उसके वजह से they are more prone for fungal infections. Youngsters and adults, like the older generation and the younger generation, both all everyone are prone for fungal infection depending on their occupation. If they are more sweating and they are more, even in old people, if they are sitting in one place, if they are bedridden, they are also more prone for fungal infection. And whether you are sweating or whether it is very watery, the fungus grows there. So these are the patients who are prone for fungal infection.
ओके, सो दैट मीन्स इफ समबडी, अगर उनका पानी के आसपास ज्यादा रहना है, एंड एज यू हैव मेंशन दैट जो बच्चे ज्यादा हैंड वॉश और के पानी में ज्यादा रहते हैं, दे आर मोर लाइकली टू हैव फंगल इन्फेक्शन. मैम, इज इट लाइक दैट दिस इज द पर्टिकुलर सीजन वेयर फंगल इन्फेक्शन आर मोर एक्टिव, एंड इन समर्स एंड इन विंटर्स दे आर लेस एक्टिव? इज इट लाइक दैट?
Yes, it is more in summers and rainy. Fungal infection जो बढ़ता है वो summer और rainy में भी है. Rainy, as you can know that monsoon में clothes dry नहीं होते and people tend to wear wet clothes. So उसके वजह से that is a breed for fungal infection. And summer में कैसे it is we are continuously sweating and that environment, humid environment, gives breed to fungal infection. So more in summers and rainy, not in winters. We don't see winters में fungal infection.
Okay, so that means in rainy season they are more active,
Yes.
and people should take proper measures. Doctor, I'm sure you must have come across a lot of patients who use over-the-counter products. अगर किसी को एक family में fungal infection हुआ, and then next time the same medicines or the same we can say things they are applying. So, what are your advice to the people who use over-the-counter medicines or take medicines referred from a friend or family member?
So this is very common problem in everyday practice. We encounter patients who are taking on the counter steroids. So steroid is very bad for fungal infections. We have triple combination cream which has antibiotic, steroids and antifungals. This should be avoided completely. On the counter बहुत से pharmacist देते हैं कि सपाट लगाओ fungal infection कम हो जाएगा. It's all wrong. It's all the mean is very wrong. The fungal infection subsides. तुम आप steroid लगाओगे तो it temporarily gives you very nice effect. You feel itching नहीं है. You are got rid with everything. सब fungus निगल जाएगा. But the wrong factors. The fact is that the fungal is growing. It is temporary. आपकी immunity suppress हो जाती है. Once you stop using that steroid cream, वापस से वो fungus आ जाता है and it destroys your skin. स्किन बहुत थिन बन जाता है वो स्टेरॉइड क्रीम से, वो सपाट लोशन से स्किन बहुत खराब होता है. So stop using the steroid medication for fungus and consult your nearest dermat. They will give you a proper opinion on what to use and what to not use. And जो कोई patients है उनको kidney problem है, liver problem है, they shouldn't themselves use steroids. It is very bad for their health. So consult a dermat and take antifungals. Don't go for steroids or on-the-counter medication.
Okay, so as doctor said that don't use over-the-counter products if you are having any kind of fungal infection. Do refer to your dermatologist because it is important. They know how to treat the fungal infection. Doctor, now we are talking about, as we have discussed about what is fungal infection, what are the causes. What are the prevention methods, or we can say the treatments which are available for fungal infections?
There are various treatments. Suppose there is a little smaller lesions, like just the patient is having itching, सिर्फ खुजली है, lesion develop नहीं हो रहा है, so we can only treat for the itching with antihistamine. और थोड़े कम parts में है, हाथों में है, पाँव में है, we can just give antifungals. Antifungals जो azoles के group में आते हैं on the counter, you can use that, but it should be without steroids, not triple combination. और अगर widespread है, यूरिन की जगह में है, सो वी गिव प्रॉपर ओरल एंटीफंगल्स. डिपेंडिंग आपका बीपी शुगर नहीं रहना चाहिए. इफ बीपी शुगर इज नॉट देयर, we give preferably a perfect oral itraconazole and other combination of drugs. If you have liver and kidney disease, apart from this, the dermatologist gives you oral medications. And apart from this orally and topical medications, we give a lot of dusting powder. Dusting powder does half of the work. It absorbs the humidity and it keeps your skin dry. So उससे fungus कम हो जाता है. So antifungal dusting powders are available and antifungal soaps are available, which the patient can take as a treatment.
Okay, that means there are treatment options which are available. So don't treat your fungal infection by yourself. There are various different treatment options for fungal infection. Doctor, as we move forward, we also have our viewers' question who are watching this live. One question here, as we were talking about prevention, that is that true that fungal infection are always caused by poor hygiene?
Poor hygiene is one of the factor for fungal infection. अगर अपना hygiene अच्छा नहीं है, so directly you are prone to that. Other than that, immunity. If your immunity is less, that also plays a role. So both together, poor hygiene with your immunity plays a role to get that fungal infection.
Okay. And doctor, here comes up if we were talking about hygiene. So is it like that the importance of maintaining a proper hygiene? How important it is that someone should maintain a proper hygiene so that fungal infection can be affected? Is it like that a poor hygiene is affected by the fungal infection?
Yes. Obviously, a poor hygiene. अगर आपने clothes wet हो, if you're keeping them constantly wet or you're sweating, so that is accounting for poor hygiene. उधर ही आपने use किया हुआ कपड़ा वापस डाला है, तो that fungus is going to start growing in your body. So that accounts to getting a fungal infection. On the contrary, अगर आपने अच्छी तरह से धोया है कपड़े and you have ironed the clothes and worn, so you will not get fungal infection. So proper neat, clean hygiene is required to not to get a fungal infection
Okay,
and
so
not to share clothes. You shouldn't be sharing clothes with the others.
okay, that is also one point that people usually share their clothes. And here is a question as well from a viewer that can you get a fungal infection from someone else's clothing or shoes?
The person has the fungal infection and you're sharing his or her clothes because already the linen is having the fungi. The hyphae is there in the linen and the clothing and that will get accumulated. वो अपने skin में आ सकता है. It can get embedded into your skin. So avoid using others' clothes, especially in this monsoon rain season.
Yes, as Dr. Sanvi told us that avoid using someone's clothes in particular rainy season because fungal infections are high active in this season. Doctor, here is another question from a viewer that can fungal infection cause hair loss or change in hair texture?
We have certain fungus which grows on the scalp that is called as tinea capitis. अगर वो और this is very common in छोटे बच्चों में till the age of 10-12 years people get this tinea capitis and वो tinea capitis हो गया तो if it gets inflamed we call it as कीड़ियों उससे they get patchy hair loss. So that is very difficult to treat. We have to give them higher group of antifungals. So, and normally if a patient gets fungal infection or what we call as dandruff in the scalp, that is treatable and obviously there are hair loss, but it is temporary hair loss. You treat the fungus and the hair loss reduces.
Okay, that means as we have discussed about the treatment options which are also available. So if you are having fungal infection related to hair, it can also be prevented. Right. Okay. And doctor, are there any dietary precautions or lifestyle changes that can help boost the body immune system to better fight off fungal infection?
There is everything is in the skin, so nothing to do with diet. You can have anything. You can have non-veg, you can have veg, non-veg. There is not specific diet for fungal infection. Hygiene हम रख सकते हैं. Hygiene is proper clean clothing, use wears, cotton wears. You have to preferably use cotton clothes, not to go with tight clothes, and a clean hygiene. Nothing to do with diet. Diet आप सब कुछ खा सकते हैं. Nothing to get restricted for a fungal infection.
Okay, so one can eat anything if he or she is having fungal infection. Okay, so there is no dietary precaution, but as you said, hygiene is must. Hygiene precaution is one thing जो सभी लोगों को ध्यान में रखना चाहिए. And doctor, what role do antifungal medications play both in preventing and treating fungal infections?
Main line of treatment, as I told you, on the counter steroid नहीं लगाना है. So antifungal plays a very important role. बहुत सारे patients होते हैं like they have applied antifungal on their own and come to us. एक 15 days में antifungal doesn't give you magic. It has to be applied for 2 to 3 months, and there is a proper way of applying. And with topical antifungals alone, fungal infection can't be treated. उसको orally भी antifungal लेना है. Depending, we decide depending on the severity. अगर पूरे body पर है तो orally लेना है. अगर superficially hands पे है, और depending on the borders, we decide on the borders whether the patient has to be taking it orally or topically. And patient has to be very patient. They should have very patiently, they have to take this treatment, because in 15 days वो नहीं जाता है fungus. It stays till your skin fifth layer. It goes to your fifth layer. So it takes time. It takes 2 to 3 months to get rid. So the antifungals play an important role in preventing the smudge.
Okay. Doctor, a small request that can you put your screen forward a little bit?
Yeah.
Thank
Can
you.
you? Yeah.
Yes. Thank you. Thank you so much. And our viewers are asking a lot of questions here, and you're explaining it very nicely. So here another question: that can fungal infection lead to joint pain as well?
Fungal infection doesn't cause joint pain. As I told, it is only related to our skin, nothing psoriasis in it. So fungal infection doesn't cause you joint pain. Joint pains नहीं होता है fungal infection में. It is solely over your skin, not into. It doesn't affect your any other parts, any body parts.
ओके सो इट ओनली अफेक्ट योर स्किन, ये सिर्फ आपकी स्किन को अफेक्ट करेगा, नॉट अदर बॉडी पार्ट्स एज वेल। डॉक्टर, अभी हमने बात की थी द एंटी फंगल थिंग के बारे में कि कैसे एंटी फंगल जो है वो इन्फेक्शन, फंगल इन्फेक्शन को ट्रीट करेगा। देयर इज क्वेश्चन कमिंग फ्रॉम अ व्यूअर दैट कैन फंगल इन्फेक्शन ओनली अफेक्ट पीपल विद कॉम्प्रोमाइज्ड इम्यून सिस्टम?
मैंने पहले बताया है कि फंगल इन्फेक्शन, अगर आपका इम्यूनिटी कम है, लाइक कैंसर पेशेंट्स, डायबिटिक पेशेंट्स, उनमें इम्यूनिटी कम है, तो दे आर इवेंचुअली दे आर गोइंग टू सफर रिकरेंट फंगल इन्फेक्शंस। वो बार बार होने वाले फंगल इन्फेक्शंस हो जाते हैं उनको, तो बिकॉज ऑफ देयर इम्यूनिटी। तो अगर एक डायबिटिक पेशेंट है एंड इफ दे आर गेटिंग रिकरेंट फंगल इन्फेक्शन, फर्स्ट दे हैव टू ट्रीट देयर sugar levels. They have to go to a endocrinologist and get their sugar levels normally. फिर उसके बाद ही ये फंगल इन्फेक्शन बंद हो सकता है। एंड देयर इम्यूनिटी प्लेज ए इम्पोर्टेंट रोल। अगर अपना इम्यूनिटी कम है तो यू विल सफर ऑब्वियसली फॉर रिकरेंट फंगल इन्फेक्शन, और वो फंगल इन्फेक्शन कैन टर्न इनटू सेकेंडरी बैक्टीरियल इन्फेक्शन आल्सो इफ योर इम्यूनिटी इज गोइंग टू फॉर्म।
ओके ओके। एंड डॉक्टर, हमने यह बात किया था कि ओवर द काउंटर प्रोडक्ट्स और मेडिसिन यूज नहीं करना है, बट बहुत बार लोग होम रेमेडीज को भी इम्पोर्टेंस देते हैं, यू नो, वो उससे ट्रीट करते हैं। सो कैन फंगल इन्फेक्शन बी क्योर्ड बाय होम रेमेडीज ओनली? अगर कोई सिर्फ होम रेमेडीज ही यूज करे और उन्हें लगे कि फंगल इन्फेक्शन ट्रीट हो जाएगा, इट इज पॉसिबल?
नो, पहले पीपल यूज टू यूज एसिड्स, सैलिसिलिक एसिड, सपाट लोशन, ये सब लगाते थे एज अ होम रेमेडी, कुछ आयुर्वेदिक वाला। उससे कुछ नहीं होगा। इट्स योर फंगस इज नॉट गोइंग टू गो, इट्स ओनली गोइंग टू गेट एम्बेडेड अगेन अगेन, वो सुपर एडेड फंगल इन्फेक्शन हो जाएगा। सो ओनली ट्रीटमेंट फॉर दिस इज एंटी फंगल, नो अदर होम रेमेडीज आर रिक्वायर्ड फॉर फंगल इन्फेक्शन।
Okay, so no home remedies are required for fungal infection. If you are having fungal infection, go and treat the fungal infection properly. Doctor, as we have discussed about the treatment as well, how long is the duration of the treatment? Is it like that 1 month, or how many days it takes? कितना समय लगता है fungal infection को ठीक होने में?
फंगल इन्फेक्शन डजंट गो विथ मैजिक, आई टोल्ड यू, जस्ट एक वीक से नहीं जाएगा। इट स्टेज इन योर फिफ्थ लेयर ऑफ स्किन। So minimum 2 to 3 months is required for the fungal infection to go, and you have to, the patient has to take everyday medicine, like एक महीने का कोर्स दिया है, properly 1 month he or she should follow it. If you leave it half-heartedly, again it's going to relapse. वापस में आ जाएगा फंगल इन्फेक्शन। सो मिनिमम 2 to 3 months इज रिक्वायर्ड टू ट्रीट द फंगल इन्फेक्शन।
Okay, so minimum 2 to 3 months, and I'm sure you must come across a lot of people जो जिन्हें लगता है कि फंगल इन्फेक्शन ठीक हो गया है और वो in the middle of their treatment they avoid taking the medicines or treatment leave कर देते हैं. So what is your message to the people जो treatment लेते हैं but then again they avoid taking the medicines and they leave the medicines in between only. They don't take the proper treatment.
Yes. So I warn them, if you're spending so much, you have to treat yourself continuously for 1 month. You will get the result after 1 or 2 months of the treatment. And if further, if your immunity is less, then we have to increase the dose, like increase the treatment to 3 to 4 months.
Yeah, right. So please take proper treatment, as doctor said that it is important because can it reoccur as well if somebody is not treating the fungal infection properly?
Yes, it reoccurs. So
Okay.
you have to take the proper course and you have to apply the cream in a proper manner, what the dermatologist suggests. Not to apply anywhere because otherwise वो नहीं treat हो पाएगा.
Right. So as doctor said, as suggest you should do that only. Don't use over-the-counter products. Don't leave your treatment in between. Doctor has a question from a viewer that can stress or anxiety cause fungal infection?
No, stress or anxiety doesn't cause fungal infection, not your diet. It is just purely your hygiene. Stress से नहीं बढ़ता है fungal infection.
Okay, so it is not related to stress or anxiety, and as you have mentioned that it is all about the skin.
Yes.
Okay, doctor. And as we were discussing about the treatment, about the different things revolve around fungal infection, are there any misconceptions or myths that surround fungal infection that you would like to address?
That is what I told you. Stress से नहीं बढ़ता है. Any diet. Many people come and ask us if we have white type of food or non-veg खाने से fungal infection बढ़ता है. This is all are myths. Reality is nothing. You can eat anything and stress doesn't increase. And there is other like psoriasis also looks like fungal infection. Psoriasis में stress लेने से बढ़ता है. So it often people get confused with psoriasis and fungal infection. So that is one concept. And even eczema. Eczema also aggravates with your particular allergies and all. So that also looks like initially like fungal infection. So people have a myth that I have eczema, but actually they have the fungal infection.
Okay, so that means fungal infection is the only problem related to skin. It does not affect your body. Am I right?
Yes, yes. The other parts, other systems of the body are not getting affected. Only your skin is getting affected in fungal infection.
Okay, so only your skin is getting affected. The other part of the bodies are not. Doctor, what if someone do not treat fungal infection?
If you don't treat fungal infection, you're going to go into widespread fungal infections. पूरा body में फैल जाता है and that will lead to secondary bacterial infection. उसमें boils आते हैं, we call it as pustules, and you get secondary bacterial infected and you get fever and it can go into erythroderma. Erythroderma is a state where your skin gets loose and you will lose your protein with your skin loss. एंड वो फिर प्रोटीन कम हो जाता है, योर बॉडी गेट्स मैसरेटेड. वो सब सेकेंडरी कॉम्प्लिकेशन है इफ यू डोंट ट्रीट. सो इनिशियल स्टेज में यू हैव टू ट्रीट योर फंगल इन्फेक्शन, नॉट टू गो इनटू सेकेंडरी बैक्टीरियल इन्फेक्शन.
Okay, and doctor, how can a person examine that this is particular fungal infection?
मैंने पहले बोला था लाइक यू गेट अ पर्टिकुलर रिंग वर्म. ऐसे व्हाई इट इज कॉल्ड एज गजकरण बिकॉज elephant's ear, how a elephant's ears look, the fungal infection is like that. It is round in nature and a particular border है उसमें. So ये ring जैसे दिखता है. So if you're getting fungal infection, if you're getting a ring or any part of your body, that means you're getting a fungal infection. और बाकी के जो diseases है like eczema, you will not get a particular ring. उसमें पानी छूट जाता है, like you will have watering over the lesion. बट फंगल इन्फेक्शन में एक रिंग आता है, उसके ऊपर स्केलिंग आता है, स्किन ड्राई पड़ जाता है एंड उसमें इचिंग हो जाता है.
Okay, so a ring-like structure, that means that is particular fungal infection, and you need to consult to a dermatologist. Doctor, what steps do you recommend individuals to take to advocate for greater awareness and prevention of fungal infection in their communities and rather than in their environment?
Particularly, one suggestion is hygiene. Keep a very good hygiene with your clothes, and keep always wear a cotton clothes and keep it dry. And that's what I want to spread. And don't take on the counter medications. Don't use your brains and take steroids. Many people half the time come with applying steroids. So don't use, the pharmacist doesn't know what is your disease, and nor you know on the Google searching what is the disease. So go to an expert and get treated, and have a good hygiene, maintain a very good hygiene, then you'll not get a fungal infection.
Okay, so good hygiene is required, and as Dr. Sanvi said, that proper hygiene is must. And if you are having any fungal infection, do refer to a dermatologist. Don't use over-the-counter medicines. Doctor, any advice you would like to give to all the people? Because today, in this digital world, everything is on social media, and everybody, just if they are having something, they just uh, write it. So, what advice you would like to give to all the people right there?
So when you're searching, the lesions which we photographically see, the Google can't diagnose your lesions. So don't refer Googling and all to the fungal infections. Go seek to an antifungals. Search for a azole group of drugs as an antifungal, not a steroid group of drugs. That's only advice. And whenever you're searching for fungal infection, obviously there are awareness of hygiene, but treatment part, see only you seek to a antifungal and you order on the counter antifungal, not a steroid.
Right. So, a very good advice that do not treat your infection by your own, and there is a difference between a professional. So, please do not avoid that. If you are having any kind of fungal infection, any symptoms, do refer to a dermatologist right away. Doctor, before we end this very informative live session, any takeaway message you would like to give to all the viewers watching this live today?
My takeaway message is, especially in the monsoon, have a good hygiene. And if you're getting recurrent fungal infections, you seek a dermatologist. Apply your antifungals thoroughly for 1 month without skipping a single dose, and you will get the results. And apply it in a proper manner. What we say is, we apply it to the borders, not to the central region. Apply it around the borders, and upon that, apply a dusting powder so that you don't get extra humidity over the lesions. And this is how you can treat your fungal infections, and even tell your family members who are getting fungal infections not to use each other's clothes, which is a communicable disease. Not even bed sheets should be used by each other. So this is a way you can prevent fungal infection and stop using on the counter medication.
Okay, okay. Very, very, very informative that don't use over-the-counter medications. Do not use each other's clothes. And if someone in your family is having fungal infection, as Dr. Sanvi already told that their products should be washed differently. You should not wear tight clothes and avoid going to wear wet clothes in rainy season as well. And I think thank you. That was very, very, very informative. Thank you so much. Dr. Sanvi Nigade, for your valuable time. And it has been very informative session for our viewers, and it is great to hear you.
Thank
And we really look forward for many more such session in the coming time for our viewers as well.
you. Yes, thank you.
Thank you, Dr. Sanvi, and thank you, viewers, for your participation for today's session, and issued in public interest by makers of Nulliber Lotion Advanced Genix, a division of Hetero Healthcare. Thank you, Dr. Sanvi. Thank you so much to all the viewers for your excellent participation, and stay connected to our channel. Do not forget to subscribe our channel, Radiance with You. Thank you, and good day to all.